Intro to Sculpting. Let's take a look at pearls and pitfalls for residents beginning their first few cases. So we're going to zoom in here on an ideal trench cross-section, essentially from the surgeon's view. So the ideal trench has steep sides and goes fairly deep into the substance of the nucleus, and what it facilitates is placement of your phaco probe and second instrument to allow proper vector forces, which you see here. The ideal trench sculpts deep enough that you essentially have epinuclear and cortical material left with as little nuclear fragments as possible. Alternatively, you'll see some attendings advocate to widen the anterior portion of the trench. What happens is the phaco sleeve can sometimes get hung up on the corners of the trench, and so by widening it, it's easier to get those deeper passes to go through. But you see that it still leaves a lot of steep wall for placement of the instruments for purchase for the splitting forces. We're going to turn that lens 90 degrees now and look at the length of the trench. And so this is basically a copy of the femtosecond laser pattern. If you've ever seen videos of femtosecond laser surgery, you'll see that it divides the nucleus essentially just inside the capsula rhexis, so about 5 millimeters here, and it perfectly mirrors the posterior curvature of the lens. And again, you can see that it allows perfect placement for your instruments for splitting. Another thing to note is that it leaves quite a bit of material out here near the equator of the capsule. That's okay. That's not going to hold up your cracks like other issues will that we're going to look at here in a minute. So if this is the ideal, this is probably what most residents' first attempt at a sculpt looks like. Usually you do okay down here at this distal corner away from the surgeon, but it's much harder to get the subincisional area sculpted out. You can see that we haven't really hit our targets for the phaco probe and second instrument. There's a lot of material here centrally, a lot of nuclear material. The fibers of the nucleus split differently, and so if you leave them in place, it's not that the lens is too strong to crack, but it's that the fibers allow alternative pathways for your crack to propagate. So rather than getting a nice straight line with two even halves, often you'll get interlocking pieces that are much more difficult to get out with the quadrant removal. And so after doing this for a few dozen cases, residents will come to the realization that they need to sculpt deeper. And this is where they start to get into real trouble. And they forget about the curvature of the posterior capsule. And so you can kind of see here this very translational linear sculpting pattern that works just fine centrally, but this is where we see a lot of the posterior capsule ruptures from sculpting. It's usually here in this distal corner away from the surgeon. This is probably a more realistic view. But there's usually just a little hole right there in the capsule, and it's because you sculpted too deep, too peripherally. It's not that you sculpted too deep centrally or anywhere else. It's just right there at the corner because you forgot to account for the curvature of the capsule. This curvature is fairly difficult to emulate for beginning surgeons, and because this curvature is dangerous, I recommend the stair-step approach, which looks like this. So your first pass with the phaco probe goes from rhexis edge to rhexis edge, and then each subsequent pass goes deeper and shorter until really you're just sculpting out that very central, very posterior aspect of the lens. It's where you have your best red reflex because you're directly on axis, and it also allows for perfect placement of the instruments, as you can see. All of this extra material does not need to be removed to allow the lens to split. And so anything you do out here, in my opinion, is wasted phaco energy. So getting down here, it's easier for beginning surgeons because you're just going straight across, and it's safer because you stay out of this danger zone that we talked about down here. So give that a try, and happy sculpting.